told you, the holiday season isn't just stressful for your wallet or your waistline. It's secretly sabotaging your hormone levels as well. But what if those mood swings or cravings that you're brushing off as just PMS are actually being amplified by everything you're doing right now? Premenstrual syndrome or PMS is a collection of physical, emotional, and behavioral symptoms that happen during the luteal phase of the menstrual cycle, typically 1 to 2 weeks before menstruation. It develops from hormonal fluctuations, particularly estrogen and progesterone, and how they interact with neurotransmitters. Those are other chemicals like serotonin in the body. Common symptoms, which we'll go into in a lot more detail later, include things like mood swings, irritability, bloating, breast pain, fatigue, and food cravings. Have you heard of the more severe form of PMS, that is PMDD, or premenstrual dysphoric disorder? I recently saw a young woman with this condition. It was a stressful situation because the extent to which it had completely taken over every aspect of her life was alarming. PMDD has been included as a psychiatric disorder in the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders. What about you? Have you ever felt your PMS symptoms get worse during the holidays? Maybe more irritable after a late night party, or bloated after indulging in some festive treats? Please share your experience in the comments section. I'd love to know how you manage them, or if these symptoms just sound familiar to you. Let's talk about who gets PMS or who is at risk of developing it. Globally, PMS affects up to 75 out of 100 menstruating women at some point in their lives, although the severity can vary. It appears that female university students are most affected by PMS. The rate of PMS is high in this group of women, and just like in my patient, it can adversely affect life and academic performance. But let's look at the risk factors a bit more closely. First, the age. It appears most common in women in their late 20s to early 40s. Next, lifestyle. High stress levels, poor sleep, low physical activity. What about your diet? We think that diets high in sugar, caffeine, processed foods may increase the likelihood of having severe symptoms. There's also something to say about your background medical history. For example, a woman who has underlying mood disorders, such as anxiety and depression, appears to be more prone to PMS or PMDD. So let's look a little bit closer at how we can tell if someone has PMS. What are the symptoms? They're grouped into the physical, emotional, and behavioral category. Physical symptoms can include feeling bloated, water retention, and your weight fluctuating. Some women can experience headaches, others get severe ones like migraines, others might experience swelling and tenderness of their breasts. The next category is emotional or mental symptoms, and these include mood swings, anxiety, or even depressive episodes. There may also be a sense of feeling overwhelmed or difficulty concentrating. Lastly, there are behavioral changes that can include cravings for sweet or very salty foods, sleep disturbances, or feeling drained and exhausted. So let's talk about holiday-induced PMS. How is it different from PMS at other times of the year? There's something I'll call the holiday factor. The festive season can amplify typical PMS symptoms thanks to lifestyle changes and stressors that are just unique to this particular period. When talking about stress, we're looking at increased financial stress, family obligations, busy schedules. All this can increase cortisol levels, which can make hormone imbalances worse. Of course, typical during this season are dietary changes, which can include excess sugar, caffeine, drinking more alcohol than usual, all of which can worsen the feeling of bloating, tiredness, and lead to mood swings. Late nights during the holiday season and bright holiday lights can also lead to sleep disruption. This affects your melatonin or sleep hormone levels, leading to more problems with your sleep cycle and affecting hormone regulation. So in other words, during this time, your symptoms may just feel more intense and prolonged thanks to overlapping factors like stress and diet. You might feel more emotionally sensitive thanks to the family and social pressures that we experience during the holidays, which is exactly what got my patient into the crisis that she experienced when I saw her not too long ago. So now let's look at effective natural remedies if you find yourself in this situation and what you should avoid. Usually non-pharmacologic or non-drug therapies are the first line of management if you have mild symptoms, while those with severe symptoms and PMDD tend to be treated with drug therapy, especially antidepressants like the SSRIs or the selective serotonin reuptake inhibitors. But the non-drug therapies that we use to treat mild symptoms when it comes to PMS include things like physical activity and exercise, looking at your nutrition and diet, some herbal preparations, cognitive behavioral therapy, adequate rest, regular hot baths, and in some cases vitamin supplements. So let's talk about them. First, magnesium-rich foods and supplements. This can help with bloating, cramps and mood swings, supporting muscle relaxation and your body's production of serotonin. To ensure your body has enough magnesium for its needs, make sure that you get lots of spinach in your diet. Moderate amounts of nuts, seeds and dark chocolate would also help. And if you're not into any of that, then you can get some magnesium supplements from your local health store. Next, herbal teas or herbal preparations. For example, chamomile. Chamomile is good for soothing irritable mood and helping with sleep. Ginger can reduce inflammation and help with menstrual cramps, while taking peppermint tea is excellent for digestion. We know can help with bloating symptoms. According to some studies, the fruit extract Vitex agnus castus is the only herbal medicine proven to control PMS associated mood swings and irritability. I've mentioned already, but regular exercise or any kind of activity that gets you up and moving, gets your blood flowing, promotes endorphin release, which will counter irritable mood and fatigue, but also helps to regulate your blood sugar and stabilize your energy and reduce mood swings. What is it about your diet? Well, the thing is to focus on balanced meals with complex carbohydrates instead of high-fat processed foods. This will help to stabilize your blood sugar to prevent insulin spikes, reduce irritability and fatigue. So include things like whole grains, sweet potatoes, legumes, and so on. Simple ways to relieve stress, including yoga, meditation, aromatherapy, any of these types of self-care activity, reduce cortisol levels, improve overall hormone balance. Lavender essential oil can be very calming for mood swings as well. Which of these remedies have you tried, or do you have a go-to system, something that's worked for you for managing PMS? Your tip might actually help someone get through these holidays. Let's take a quick look at what to avoid. I've mentioned alcohol and caffeine. Alcohol can worsen mood swings and bloating because of its effects on estrogen and dehydration. Caffeine, whether you're getting it in your stimulant drinks, coffee or mocha or whatever, increases anxiety and can disrupt sleep, so it would make PMS irritability feel a lot worse. Wherever you can, avoid sugary foods and simple carbohydrates, soda, cookies, cakes, breads, and so on. They will simply spike your blood sugar, just leading to energy crashes and fatigue or cravings in the long run. And in line with that, avoid processed foods that are high in salt, crisps and chips and so on. They will contribute to water retention, bloating, simply making your discomfort worse. So girls, holiday-induced PMS is a real challenge. But if you pay attention to dietary choices, managing stress, and using some of these natural remedies I've talked about, I think it's manageable. Let me know what you think. I'm looking forward to hearing your thoughts in the comment section below. Give this video a like, and I'll see you again soon.